favorite subject now. That's whether you can drink wine or not when you're trying to get pregnant, and how much coffee can you have if you're trying to get pregnant. So if we take wine first, there's loads of different theories around this. I mean, it's absolutely baffling. Even I myself find it very difficult to understand in terms of what one study has shown and then another one seems to disprove, and there's constant conflict around all of this. I think the majority of us doctors and experts would agree that drinking, certainly when you know that you're pregnant, shouldn't be done, simply because this has got quite a high chance of increasing potential problems with the pregnancy, such as preterm birth or lowered birth weight or congenital problems with the baby, not to mention miscarriage rate. However, the difficulty lies in terms of the advice to give a patient or any couple in the lead up to conception, which can, for some people, last several years. So telling someone not to drink for this entire length of time is probably really quite unreasonable. And in another sense, you could also argue that you're stripping them away of any sense of enjoyment that they may have with a particular glass of wine in the evening. So what I would say here is that there are no studies that have proven that you mustn't drink at all in the lead up to conception. And we all know that there are those instances when a couple may have quite a bit to consume and suddenly finds themselves pregnant afterwards. But what I would say is be careful if you're very serious about wanting to start a family. I would advise that you cut right back, and if you're used to drinking a glass of wine per day or having binges, to stop doing this and maybe cut down to 1 or 2 glasses a week, which may sound quite strict, but I think this is possibly the safest approach because we don't know enough to say otherwise. The one thing that studies have shown is that couples undergoing IVF, so these are couples who've been proven to have difficulties conceiving, if they drink, in particular in the time closest to the point of IVF, they have an increased chance of failed implantation and miscarriage. So we know this for IVF couples. What we don't know for certain is for couples who happen to get pregnant through another means. So I think be sensible with this approach. Don't entirely stop all alcohol, especially if it gives you some pleasure to do that, but just be really sensible and really careful, and in particular avoid any binges. One of the common myths out there is that if you save yourself up for having a lot of alcohol in one go on a particular weekend or particular time of month, that this might in fact be okay because you've cut back on all the other days. But in fact, this is possibly the worst form of drinking, because what the alcohol is doing is circulating around the body. There aren't enough liver enzymes to actually process it, and it ends up being a toxin and causing all sorts of potential damage to your hormones, sperm and eggs, as well as to your general health. So please, people, don't do it. The other subject that I wanted to cover briefly here is that of caffeine. Again, much like wine or any other alcohol, there aren't too many studies that have proven or disproven any particular quantities that are safe here. But I'd say as a rule of thumb, sticking to 1 caffeinated drink a day is okay. So this is usually a coffee for most people, but bear in mind that tea also contains caffeine, and that also a couple of foods will also contain caffeine. So you want to be careful in terms of the amount of caffeine that you ingest, and that's because this essentially can increase the amount of stress hormones in your body, which can have a negative effect in terms of fertility, in terms of the effect on hormones and effect on sperm and eggs. So the general message I want to get across here is moderation and balance, and trying to cut back, especially if you're really keen on wanting to have a baby.